Good evening, everyone. Good morning. It's so good to see all of you today. We're all in the same platform, all in different parts of the globe. Oh, welcome everyone from the Caribbean, everyone from Latin America, and good to see you. South America, US, Canada, Europe, oh, the Middle East, Asia. Oh, we cannot forget Australia. Thank you, everyone. Thank you for coming here today. My name is Dr. Paula Henry. I'm a part of the EarthMedic EarthNurse team, and I would be your moderator for today. Welcome. Welcome, everybody. I'm going to give you all a minute to enter. Oops, I'm changing my slides. I wonder why. Still going to give you a minute to I don't want you all to miss a drop here today because we are going to have so much to say. Welcome. Oh, thanks for coming. Thanks for coming. Thanks for coming. Oh, good to see everyone. Good to see everyone. Good to see everyone coming in. Okay. Okay. That's nice. That's nice. I'm telling you, we're really going to have a very exciting session today. And today would be we're going to continue the saga today, the second edition of our Caribbean Climate and Health Responders course, Education for Action. This is session 6, and we're going to be talking about vector-borne and zoonotic diseases. I would just like to remember to acknowledge my partners, the Consortium for Climate and Health Education at Columbia University, my partners, EarthMedic, EarthNurse, PAHO, UE, and CIMH. Today, you can actually choose what language you would like to hear this recording on, this webinar. You can choose English, you can choose Spanish. You can just look at the button below and choose which interpretation you want to have. So this is an outline of the course schedule. As I told you, today is session 6, but you know what? We have 4 more sessions coming up. So you need to stay tuned in. And for those of you who do not know how to do that easily, just join our WhatsApp group. We keep you posted. So our learning objectives for the day: to explain the environmental processes changing as a result of climatic change and how they impact the prevalence, incidence, and distribution of vector-borne and zoonotic diseases. For the following diseases, describe how climate change is influencing their distribution: leptospirosis, dengue fever, chikungunya, Zika. We are also going to be making passing mention of tick fever, malaria, West Nile virus, and the effects of deforestation, bushfires, climate change, bringing forest habitat into closer proximity to humans. We are going to explore what actions health professionals can take to identify and protect their patients vulnerable to these diseases. And lastly, we are going to define steps that the health sector can take to become prepared to address shifting geographic burdens of vector-borne and zoonotic diseases, including surveillance and early warning systems and broader interdisciplinary coordination. Just to remind you, this is a 90-minute session. First of all, we're going to have the expert lecture by Dr. Chris Oura, and then we're going to follow that up with the case history. The sessions will end with a Q&A, and please post your question and answers in the Q&A section. All sessions will be recorded and posted on the webinar on the website within 24 hours. Reference material and slide decks would also be included on the website. You can be awarded a certificate of participation. Participants who attend more than 70% of the live Zoom sessions and pass the final exam with a score of more than 70% at the end of the course will be awarded a certificate of participation in climate and health from EarthMedic, EarthNurse, and the Global Consortium for Climate and Health Education. Participants must join each class session using their personal unique Zoom link and complete the final exam using the email address used to initially register you for the course. Attendance will automatically be recorded during the live Zoom sessions. The exam link will be sent on the final day of class via email and will remain open for 48 hours. Certificates will be awarded on May 9th, 2024. Just to remind you that you can get CME credits for attending these sessions. You can get 1 CME credit per session. But for you to get that credit, you must fill out the post-survey link, which is posted in the chat in the last 15 minutes. In that in the post-survey link, you will find the request where you can tick if you want a CME credit. So just remember, if you want a CME credit, please fill out the post-survey link, which is going to be posted in the chat at the end of the session. CMEs are free, and they're applicable to people who live in the CARICOM region. So now we come down to the exciting part. Our 2 presenters for today, Dr. Chris Oura and Dr. Sharlene Sanchez. Dr. Chris Oura. Dr. Chris Oura is a professor in veterinary virology at the School of Veterinary Medicine, University of the West Indies, UWI in Trinidad and Tobago. Chris has worked in many countries around the world, including Mexico, Uganda, and Zimbabwe. He took up the post at UWI in early 2012 and is currently running a One Health-based research program. He has received the UWI Vice Chancellor Award for Research and is currently a member of the UWI COVID-19 Task Force and the lead for the Climate Change and Health Leaders Fellowship Program. Welcome, Chris. He likes to be called Chris, but he's really Dr. Chris Oura. Now, I would like to also welcome Dr. Sharlene Sanchez. She might be new to this platform, but she's not new to zoonotic diseases. She is a consultant in internal medicine at the Arima General Hospital, and she is a part-time lecturer in the Faculty of Medical Sciences at UWI St. Augustine. She has been under the employ as a public health tertiary in the public health tertiary system for over 10 years and was assigned to a COVID hospital during the pandemic for the care of patients with severe presentations. She's an active participant in research for communicable and non-communicable diseases and in protocols and guideline developments in healthcare. Welcome, Dr. Sanchez. So after that, there is nothing more for me to say than to say, take it away. Please, Dr. Oura, we are waiting to hear you.
Great.
Thank you.
Thank you very much, Paula. And hopefully we will now be having some success with you seeing my slides. So can you just say, Paula, whether everything can be seen and you can hear me okay before I kick off?
We can see you perfectly. The
Great.
slides are clear. Go ahead, Prof.
Thank you very much. So, it's a really great pleasure to be here. Thank you very much to the organizer of this course. It's a great pleasure to be with you tonight. Actually, I'm in Spain at the moment, so it's midnight. I saw there were a few people joining from Spain as well. So, hola a todas las personas de España y Sudamérica. It's really great to see all my friends as well. Special shout out to the Climate Change and Health Fellows as well, and all the people that I know. So I'm going to be talking to you a little bit tonight for around climate change and climate change's effect on vector-borne and zoonotic diseases. Many people, when they talk about climate change and health, the first thing they say when you ask them, so what health impact is climate change going to have? They talk about zoonotic diseases, and they talk about especially vector-borne diseases and dengue, because in the Caribbean, we all know how much we suffer from these. So I'm going to talk a bit today. We'll start off with a few definitions so we're all on the same page about what is a vector-borne and what is a zoonotic disease. And you'll hear me use the term One Health quite a lot throughout my presentation, because I think it's so important that we approach these diseases which affect human animals, which are affected and affect the human-animal environmental intersection, are approached using a One Health approach. So I'm going to be talking about whether is climate change affecting vector-borne diseases and how? Because currently, as we know in the Caribbean, we're seeing very severe outbreaks of vector-borne diseases. I'm also going to be talking a little bit about zoonotic diseases, about future pandemics. So we've all been through COVID and we've seen, especially in the Caribbean, various nasty zoonotic diseases like Zika and chikungunya, and we have dengue coming through. So really how climate change is affecting them. So you as health professionals can, when people ask you, you'll hopefully be able to answer them a little bit more scientifically accurately about why climate change is affecting these diseases. I'll then finish off by talking a bit about how can the health sector as a whole become more prepared to address shifting geographical burdens of vector-borne diseases and zoonotic diseases. That's a big topic in itself. And then about you, I know there are many health professionals here, many doctors, many nurses, when people working in the health sector, what you can do. And we're very fortunate to have Sharlene, who's going to be giving us a really relevant case study after that. So I hope that's okay with everybody. So we can kick off by just setting the scene a little bit, talking about vector-borne diseases. And vector-borne diseases are diseases transmitted by the bite of an infected arthropod species. Now, arthropods are cold-blooded, that's ectothermic. And therefore they're sensitive to climate factors, and they're not able to regulate their own temperature. So when it gets cold, these arthropod vectors get cold. When it gets hot, they get hot. And of course, that has big effects on their biology. These arthropods include mosquitoes, biting midges, or culicoides midges, we call them, or some people call them no-see-ums because they're the ones that bite you in the dawn and dusk and you can't see them, but you know something's biting you. Many ticks, bigger bugs like triatomine bugs that transmit diseases, sandflies and black flies. So these are all vectors that transmit diseases. And when it comes to a zoonotic disease or a zoonosis, they're infectious diseases that are transmitted from animals to humans. So that's putting what we're going to talk about today into perspective. And I'm not going to talk about climate change itself. We can see on the right, I'll just get my my laser pointer. This is what is causing the problems that we all know, and we've heard in previous great talks during this series about how temperatures are rising, both sea and land temperatures. And these are what I'm going to be talking to you today about, how these changes in temperatures, how these effects of climate change are going to are and will affect vector-borne diseases and zoonotic diseases, focusing on the Caribbean, but talking a little bit about the world, because I know we have many people from many different countries here. So you can see on this very, very busy slide, on the left-hand side over here, you can see all the many diseases that many of you would have heard of. And we in the Caribbean are very aware of dengue, yellow fever, Zika, chikungunya. Many countries, of course, in the Caribbean and around the world, of course, malaria is a major problem. And then we have lots of other, what were more neglected tropical diseases you can see here, which are prevalent in many countries in South America, Africa, not so much in the Caribbean. We have lymphatic filariasis, schistosomiasis, onchocerciasis, Chagas disease, leishmaniasis, all the way down to West Nile fever and tick-borne encephalitis. So these are all vector-borne diseases. They're transmitted by vectors. And the pathogens that are transmitted, you can see here, they're different viruses, different bacteria, and different parasites that result in the disease, in the vector-borne disease. And the vectors are all different as well, and the vectors are specific for the different pathogen and cause the specific disease. And different vectors transmit different diseases, like malaria is transmitted by a mosquito species called Anopheles, whereas yellow fever, Zika, and chikungunya are transmitted by those really, really high-biting, nasty mosquitoes we see a lot in the Caribbean with little white spots on their legs and on their bodies called Aedes aegypti and Aedes albopictus. And then many of these other lymphatic filariasis, for example, and others are transmitted by different vectors like snails and triatoma bugs and sandflies and different species of mosquitoes and ticks. So we've got lots of different vectors out there. And of course, when the life cycles of these parasites, these bacteria, these viruses, are dependent not only on the vector, but they also they have an animal, often have an animal and sometimes a human host as well, that are essential for the virus, the bacteria, the parasite to pass through its life cycle. And there's mostly the problem is in humans, like you can see the ones where it says non-human hosts of minor concern, but others, mammals and rodents and pigs and wild and domestic animals play a critical role in the life cycle in maintaining these viruses, these bacteria, these parasites, these vector-borne pathogens in the environment. So let's just have a quick Zoom question to start with. Just so we understand the importance of where emerging diseases actually come from. And you can see the questions here, and let's just give you just a few minutes to answer that question. You know that I'm a vet, so you know my background as a vet, so probably it's probably going to be reasonably high. And we can see, yes, you're all doing pretty good there. And we've got lots of answers coming out, with the majority, 75%, being C, which we're going to just leave it a little bit more because you're doing great job. Okay, great. So I'll end the poll there, but you're correct. The majority of you are correct in the fact that 75% of new and emerging pathogens in humans, and that's pathogens that we all know about, like dengue, Zika, chikungunya, Ebola, they have come through animals. So the answer is C. It's very high. And I always tell this to my veterinary students, because I say you're actually more important than medical students, because you are at a critical point just stopping these pathogens getting. If we stop the pathogens coming through animals into humans, we can save an enormous amount of money. And I'll send you a little graphic. I'll show you a little graphic about that in a second. So when it comes to vector-borne and zoonotic diseases and One Health, it's important to note that most vectors feed on a wide range of hosts. And that includes animals, wildlife, domestic animals, and humans. And many pathogens are reservoired. They maintain themselves in wildlife and spill over into livestock or people. So hosts can be amplification hosts, where they have a high viremia if it's a virus they're infected, or a high parasitemia, or a high bacteremia. And this is high enough to infect vectors. They can also be dead-end hosts in some cases, where the viremia or the bacteremia or the parasitemia is not high enough to infect the vectors, but they still cause disease in the dead-end host. And humans are hosts of several, as we've shown on the previous slide, vector-borne diseases. So as I said just now, preventing the transmission in animals can protect humans. And this is an important part of One Health, was understanding the very close connections between the health of humans, animals, and the environment. And when it comes to big lessons we can learn when it comes to One Health, including the lesson of COVID-19, for example, we can see that when animals are exposed, when a virus or a bacteria or a parasite is in animals, the cost, which is this big line here, the cost of control, is very low. When we get clinical signs in animals, it remains low. But as those pathogens pass into humans, and there's exposure in humans and clinical signs in humans, and then humans seeking medical care, like, for example, we got with COVID-19, which went from wild animals from bats, probably then to civet dogs or civet cats, and then into humans, the cost of the outbreak is absolutely enormous. So keeping the pathogens to the left in animals is absolutely critical going forward to avoid these future pandemics. And this involves the One Health approach. So how climate change affects infectious diseases? There are many ways. Climate may affect the spatial distribution of outbreaks. That's where is the outbreak. Climate may affect the timing of disease outbreaks. When does that outbreak occur? At what season? At what time of the year? It may affect the frequency of disease outbreaks. How many disease outbreaks do you have at one time, or within the year, or within a 3-year period? How often they happen, and also the intensity and severity of outbreaks. How bad is the outbreak? Can be and can be affected by climate change. Also very importantly, and I'll give you an example about this later, the ability of a pathogen to spread when it's first introduced into a country. If the conditions are right in that particular time, when that particular pathogen comes into the country, then it can cause a new outbreak and spread dramatically. If the conditions aren't right, it'll just die out. And climate can have a very important impact on that. So how does climate change affect infectious diseases? It affects pathogens because pathogens often go through a phase in their life cycle where they're free living and outside the host. And we know that any pathogen like us is susceptible to temperatures, it's susceptible to the environment when it's in that free living stage outside the host. And climate change obviously can affect that the conditions at that time. Also effects on the host, the immunity of the host. In certain circumstances, climate change can affect the host's immunity, resulting in immunosuppression, such as in people, for example, with non-communicable diseases being affected by climate change. In heat, you get immunosuppression. Can also affect the vectors, and I'll talk much more about this and how it affects the vectors in a moment. It can also affect on the dynamics, the contact rates between the animals, the wildlife, and the humans and the vectors. And that will have an effect on the infectious disease. And also, very importantly, on indirect effects, the effects of other disease drivers. There are many other disease drivers that are causing infectious disease apart from climate change. And climate change can have an indirect effect on these other disease drivers. So climate change and how it may affect pathogens. As I was just saying, to get from one host to another, many pathogens spend time in the environment and they're exposed to the weather. And so if that weather is bad, that temperature is very hot, it can have an effect on those pathogens. Or if the temperature is colder as well, it has an effect on those pathogens. The climate also affects pathogen development time and survival within the vector, and I'll talk about more about this in a moment. Longer seasons may increase the number of cycles, so you get more vector-borne diseases, you get an increased number of cycles of vector-borne diseases. Mild winters may increase or decrease between season or interseason pathogen survival. Many pathogens, what we call overwinter over cold periods of time. And if those winters are less cold, there's more chance of them overwintering and surviving between seasons. And also climate change may affect disease seasonality. We're seeing the seasons changing so much around the world. And this is going to be affecting vector-borne diseases. And also, as many of you know, many pathogens are transmitted in the air, in aerosols, like COVID-19. Remember, that's an aerosol transmitted. Some other viruses, like there's a virus of animals called foot and mouth disease, can be transmitted in aerosols for over 20 kilometers. So if you get a climate change causing more dry conditions, Where the aerosols are dried out or more hot conditions, there will be less chance of those pathogens being spread by aerosols. So, as I said earlier, I think it's very important that we all understand that it's not just climate change and weather that are affecting vector-borne and zoonotic diseases. There are many different drivers of disease. And as you can see up here, climate change is a very significant driver, but there are many others like land use change and agricultural industry changes and antimicrobial agent use and war and famine and food industry changes and breakdown in public health, feeding of bushmeat. So there's many things here, as you can see in this figure, that are interacting, including climate change, that act as drivers of disease. So it's a complicated picture. So I'm going to ask you another question now. If you can have a little go at this one, we will see how you get on. So please answer the question as best you can. Good. We'll just give you a little bit more time to go for it. And yeah, and it's very close between A and B, with B just coming out on top. And you'll be glad to know that the correct answer is B, which is increase the incidence. Climate change will increase the incidence and geographical spread of some vector-borne diseases, but some will reduce and may disappear completely. And so what some might say, it's not all bad news, but so some, and I'll explain exactly why that might happen, why the answer to this is B in a second, because often people think it's A, that they're just going to increase and they're going to carry on increasing as temperatures increase. But the answer to this is B. So, as I say here, is climate change affecting vector-borne diseases? The answer is a big yes. And we can see here that we have this intersection between the vector, the host, and the pathogen, and this nidus of pathogen transmission in the middle. And it's very important how large this nidus is as to how is the interaction between these hosts, the vector and the pathogen. This is surrounded by the environment, which affects all three, which affects the host, the vector, and the pathogen. And changes in temperature and precipitation, like rain, affects the environment in which the vector-borne diseases are transmitted. And these environments may become more or less favorable to vectors and to disease transmission. And it's important that vectors, of course, and hosts, but vectors can move to favorable conditions as well. And we're seeing this happening in many parts of the world, where as the climate changes, the vectors move to more favorable conditions, and we suddenly see diseases in areas, vector-borne diseases in areas we didn't see them before. We're seeing this, a good example of this is malaria and the transmission by mosquitoes occurring at higher altitudes, because the mosquitoes weren't able to survive at the higher altitudes in the past. But as those higher altitudes get warmer, they're able to survive there. So we see malaria in populations at these higher altitudes. Also examples would be leishmania, which is transmitted by sandflies, which is moving from south to north in Europe and from north to south in Argentina. So it's moving actually from hotter to cooler areas, because the cooler areas are getting hotter, and those sandflies are able to survive in those cooler areas. And also in Canada and the USA, many people who are on this call from up there, they know that heat waves are causing the northward displacement of ticks responsible for Lyme disease, and Lyme disease is now being seen further north in these areas. So, as we're saying here, climate change is affecting vector distributions, population sizes, and seasonality, and higher temperatures are affecting vector competence and vectoral capacity. And I'll explain what these two things mean in a second. So yes, climate change is affecting vector dispersal, with vectors moving to more favorable conditions, as I've just explained, and extreme weather events, including the El Nino weather event that we've just seen, do favor some vector-borne diseases. And we sometimes see, as well as climate change, it's being exacerbated by certain conditions like El Nino, what we say natural conditions like El Nino, which has caused a lot of warming as well. And so we're seeing floods and drought. With the floods and droughts that we're seeing around the world as caused by climate change, we're seeing increased opportunities for vector breeding. And you can see here in the pics, this is the nasty Aedes I was talking about with the white spots on it, which carry dengue, chikungunya, and Zika. These ones here are the no-see-ums, the Culicoides midges, which carry many vector-borne diseases as well. And here we have an example of a tick. And ticks, many different species of ticks also carry vector-borne diseases. So when it comes to how the climate, I'm not going to go into this in too much detail, but I think it's important to have a little bit of more science so you understand what's actually going on, why temperature is increasing the spread of vector-borne diseases, and in some cases why vector-borne diseases are reducing in some areas due to climate change. So we talked about vector competence here, and vector competence is really susceptibility. So different species, like different species of mosquito, is whether they're able to transmit that particular, we'll talk about viruses here, but whether a particular species of mosquito is able to transmit dengue. That's its vector competence, its susceptibility. Now, some, like Anopheles mosquitoes or Culex mosquitoes, won't be able to transmit dengue, so they're not competent for the transmission of dengue, whereas Aedes mosquitoes are competent for the transmission of dengue. And in some cases, very rarely, you can get with Culicoides midges, you can find that certain species of Culicoides midges at certain temperatures have no competence, they're not competent for the transmission of a virus, but then as the temperatures rise, they become competent. And we've seen that with various veterinary viruses in Europe, like blue tongue. We also very important is vector-borne disease risk depends on the distribution and abundance of the vectors relative to the host. Of course, the more vectors we have, the more likely we're going to get transmission. And of course, when the virus or the bacteria or the pathogen get into the pathogen, there is the ability for it to be transmitted changes with temperature, as we've talked about, and this is called the vectoral capacity. So the ability of how efficient that particular vector is at transmitting that particular virus, and that changes according to climate and temperature. And I'll just explain a little bit about that now. You can see here in this pic, this is a mosquito, an example of a mosquito taking up a blood meal here. And the blood goes up through the proboscis, and the blood, that's the blood with, for example, let's say dengue virus in it, and it passes then down through into the gut, and the virus often replicates in the gut wall and amplifies, and then comes out into the hemosyl and back towards the salivary gland here, where it sits and it replicates in the acini, the cells of the salivary glands, and it sits there waiting to infect any host that this mosquito will feed on in the future. And that cycle throughout the mosquito is called the extrinsic incubation period. And it's critical, that extrinsic incubation period, because that is what amplifies the virus inside the host and brings it to the salivary gland, ready to be transmitted to another host. But that cycle is dependent on temperature. And as you can see here, the time from taking blood meals to becoming infectious is called the extrinsic incubation period. And you can see here as an example, from temperatures of 0 to 10 degrees, there's no transmission of the virus. And after 10 degrees, you get increased in the speed of the extrinsic incubation period. The virus is able to transmit faster through the mosquito, and then at certain temperatures, then it starts to come down, and the speed of the virus transmission through the extrinsic incubation period reduces. And for example, in dengue viruses, they will develop in mosquitoes and be transmitted only if exposed to temperatures between a range of around 20 to 35. So they don't get transmitted at lower temperatures. So this is critical to the vectoral capacity as to whether the particular virus, and this is different for different viruses, is able to be transmitted through the mosquitoes and how fast that it can be transmitted through mosquitoes. At higher temperatures, it gets transmitted at a faster rate. So this is just an example of showing the ability to transmit pathogen and what determines it, and how many feeds a vector takes on average in the time between becoming infectious and death. And this is important because it dictates how efficient that vector is at transmitting that particular vector-borne disease. So when we see the first feeds here, at the start of the first feed of the vector, it passes through, and this is the time taken for the extrinsic incubation period here in red. And then it's come to the salivary gland here, the virus is there and ready to infect another host. And all these further feeds, these 1, 2, 3, 4 feeds here that the mosquito takes, all transmit the virus to another host, and then the mosquito dies. But at higher biting rates, if that mosquito has higher biting rates, which is caused by higher temperatures, such as with climate change, you can see that the biting rate is shorter, so there's more feeding or bitings or bites that happen with that mosquito. So after you get the mosquito, the virus going through the mosquito in the extrinsic incubation period, you get five feeds. So you get more transmission than in this case here. And if, again, you get a shorter extrinsic incubation period, as you can see here, the virus actually appears in the salivary glands at a quicker time, and then again you get more chances for the virus to be transmitted through more feeds. But also, very importantly, you have to think about mortality rates as well, because these mosquitoes and these midges are dependent on temperature when it comes to how long they survive. And if you have a lower mortality rate here, they survive longer. So if that mosquito or that midge survives longer, it's going to have a chance to have more feeds. So again, you have, well, 5 feeds here, for example. So with climate change or with increase in temperatures, you're likely to get shorter extrinsic incubation periods because the virus transmits faster through the mosquitoes. And you're also going to get higher biting rates, but you're going to get higher mortality rates because those midges, those mosquitoes, don't like very high temperatures, so they tend to die because of the high temperatures. So you might see conditions like this where you've got a shorter extrinsic incubation period, you've got higher biting rates, but you've got a shorter lifespan. So these are all, what I'm trying to explain here is these are all need to be taken into consideration when you're looking at your vectoral capacity. The biting rate, which is increasing with temperature, the mortality rate, which is increasing with temperature, and the extrinsic incubation period, the time taken to get through the midge, is also increasing with temperature. So what you actually see quite often is this bell curve here. You see a certain time period when you don't get any vector transmission. Then as temperatures rise, and this is different for different species, you get a peak. And then after that peak, you get, because of the mortality rates increasing, you get the mosquitoes or the midges dying. And that's why in some cases, in answer to the question, when temperatures rise above a certain threshold, the mortality rates will take over. And because of those high temperatures, the mosquitoes or the midges will start dying. And in those cases, you will see less transmission of the particular pathogen when it gets to a certain temperatures. And you can see here on this model, and this is a projection based on the worst case scenario, but you can see here between, as you can see top here, 2019, 2050 to 2080, what you're seeing here is the months per year when disease transmission by Aedes mosquitoes is possible. And you're seeing the blue, in other words, the number of months increasing, going from white, which is no months, no transmission, the blue is 1 to 2 to 3 months, because the temperatures are rising further north. And so there's more months where the diseases can transmit. But interesting, when you're looking in, say, for example, the middle of Brazil here, where temperatures are due to rise very high, there's already now we have 12 months transmission a year. But as temperatures rise towards 2080, you'll see that's actually going yellow and then blue, because there may be less number of months where the disease is transmitted because of the higher temperatures causing higher mortality rates. Okay. So I'll just give you a few examples now of a Zika virus, because Zika virus is a very good example of what I was talking about earlier. We know that Zika virus has spread around the world, and here we see it appeared in Uganda in 1947, and then it spread into Africa, came across to Brazil, and everybody remembers it around 2015 when we saw it in Brazil for the first time. And we then saw the virus spread up from Brazil all the way up through South America, through the Caribbean, and into the USA. And it's interesting when I was talking earlier about the time being right in a particular country or a particular part of the world for onward transmission of that virus, that vector-borne disease virus, should it arise. And in this case, when we look at the annual anomaly and risk in 2015, when the virus arrived in Brazil for the first time, you can see the dark red figures here, where there was a high transmissibility, much as you can see here, the transmissibility, the potential for transmission of the virus if it arrives, was really high at this time in 2015 due to climatic factors. And when you look here, here's 2015, this is the transmission, or R0, or transmissibility, was the highest it had ever been in 2015 because of climatic factors and temperatures. So sadly, the virus may have come to Brazil, or may have come to our other area of Brazil at different years, but the conditions weren't right. But in 2015, the conditions were right at that time. We had the highest risk, and the virus, sure enough, came in 2015 and was able to spread. There's a very small example I have here of a veterinary virus as well, transmitted by these Culicoides midges, as I say, called blue tongue virus. And this is highly seasonal in Europe, and it hadn't caused transmission in Northern Europe for many years. And what we've seen in Europe over recent years is we've seen the species of Culicoides midges that we know transmit blue tongue moving north, as you can see, from 1990 up to 2005, and moving north here. So there's increased there's increased northward expansion of this particular Culicoides species from Africa, the main blue tongue vector, bringing the blue tongue virus with it. And there's also, because of warmer temperatures in Europe, these viruses were able to, were able to transmit it to other Culicoides species in Northern Europe. And we're seeing in Europe this year, and seeing much more spread of blue tongue virus as far north as we've ever seen it. which is again due to climate change, due to these culicoides vectors moving north. And then I wanted to share you with a little bit of data here, which is actually unpublished at the moment, from the latest excuse me, can I just okay. From the latest Small Island Development State Report of the Lancet Countdown on Health, and you can see here for dengue virus, you're seeing again the transmissibility. You're seeing over the years from 2040, 2060, 1960, 1980, 2000, and 2020. You're seeing an increase in transmissibility of dengue virus, quite significant. And this this is in the SIDS, and here we see in the Caribbean. And this we're seeing, as many of you know, we're seeing dengue viruses appearing all around South America this year. Some of the worst dengue virus outbreaks we're seeing. And sadly, as you can see here, Latin America, Caribbean are set for record dengue season coming up. So just to summarize on climate change and vector-borne diseases, climate change is and will continue to affect the incidence and distribution of vector-borne diseases. Some will increase and some may decrease depending on the geography and the temperatures. Climate variability is a very important cause of vector-borne disease outbreaks, and we will see as climate changes, we will see more vector-borne diseases. Climate change is enabling vectors to spread and is changing their vectorial capacity, their ability to transmit through the arthropod vectors. But we have to understand there are other drivers like global travel, trade, and human factors that are also hugely important. We are seeing more vector-borne diseases in the Americas and in the Caribbean. In the Caribbean, we've seen Zika, we've seen chikungunya, we see dengue, and sadly, we are likely to see the spread of new diseases, and there are some diseases that we're seeing at the moment, like Oura virus in South America. We have West Nile virus, and we have Japanese encephalitis virus, that are all potential vector-borne diseases that we could have spreading in our region. So I'm just going to now talk a little bit about. Sorry, my clock seems to be, my phone seems to be playing up a bit. Nobody's calling me. It's just my alarm. So, will vector-borne diseases affect zoonotic diseases? And the answer again is yes. Many of you know that as the planet heats up, many animal species will be forced to move into new areas to find suitable conditions. And that's happening all the time as we speak at the moment. And those animals will bring with them their parasites, their pathogens, and they will be able to spread and interact. And this will heighten the risk of zoonotic spillover, where viruses transfer from animals to people, potentially triggering another pandemic of the magnitude of COVID-19 or worse. So we understand that preventing the next pandemic is critical, but climate change is not going to help us with that, because climate change and many other drivers of zoonotic pandemic diseases are sadly increasing the risk of zoonotic diseases and increasing the risk of a new pandemic. So when you look when it comes to vector-borne diseases, and you can see the vectors here when it comes to the pathogens, the wildlife pathogens, and when it comes to the domestic animals, these are all critical in the fact that climate change is going to affect their distribution, as we've heard, for vector-borne diseases. And what happens normally, of course, is we have cycles in wildlife, as you can see here. But if the wildlife are coming into contact more often with vectors and with domestic animals, there's more of a chance of spillover from the wildlife populations to domestic animal populations, and sometimes from wildlife populations to human populations. And so this is what we need to try to avoid and climate change is not going to help us with this. Why is it all getting worse? Well, we all know, sadly, there's more deforestation, forest encroachment, there's more close association between animals and humans, often driven by poverty. We see wild meat markets giving the opportunity for viruses to be transmitted across from animals, from wildlife to humans when they're being slaughtered. We're seeing high density human populations and unplanned urbanizations, modern agricultural practices, and rapid global transport. And these indirectly are all being affected by climate change, which is going to result in the whole in the issues getting worse. So when it comes to domestic animals, when it comes to the key take-home messages, domestic animals and wildlife play an important role in spreading viruses to humans. However, sadly, there's a single species responsible for this, and that's humans. Recent pandemics are a direct consequence of human activity, so we must not blame wildlife. We need to change our habits and our customs, and we must learn from our experiences, or worse will happen. So it's very important that we need to follow our One Health approach, as everything is connected, and sadly, climate change as we move forward will make things worse. So finally, just to finish off, I wanted to talk a little bit about what we can do about this, managing the increased risk of disease emergence, and where should we concentrate our time and effort. And I think it's really important that we increase awareness of what is out there. We need to carry out One Health surveillance. We need to understand what pathogens are out there. We also need to protect our wildlife and reduce spillover from wildlife to humans as much as possible by legislation to protect the wildlife. We need to assess the risk of introduction, legal and illegal trade, which is so important in many countries, including those in the Caribbean, and consider how to reduce supply and demand for wildlife and wildlife meat. And as I said earlier, especially in the Caribbean, we need to promote harmonization and promote an interdisciplinary One Health approach. And when it comes to what our health sectors can do to become better prepared to address these shifting geographical burdens, we need to pair viral surveillance and discovery efforts with biodiversity surveys. So these are tracking species range shifts, especially in regions that harbor the most zoonosis and are experiencing rapid warming. And we need to invest in primary pandemic prevention, namely habitat conservation, and strictly regulate the wildlife trade so we can improve livestock biosecurity, and we need to stop wet markets. And when it comes to, very critically for vector-borne diseases, we need to design and develop a climate-driven spatiotemporal modeling framework that provides early warning of the increased risk of mosquito-borne diseases for evidence-based decision-making. And this is absolutely really critical, and we need more data to inform these models. And just to say what you can do more as health professionals, what you can specifically do is educate yourselves and understand the risks. And there's lots of great information out there in the Caribbean with the Climate Change Health Bulletin that's produced every few months, as you can see here, which provides great information which can assist you in identifying and preparing health interventions in all sorts of diseases like respiratory diseases, gastrointestinal diseases, vector-borne diseases, and mental health as well. So please look at these great bulletins. They're really, really helpful. Also, for some of you who are involved in research, there's a fantastic new research for action on climate change and health has been recently published, which is showing great research, action, interventions that are necessary in all different areas, including vector-borne diseases. And finally, my last slide is I'm going to pass over to Sharlene to give us our case study, is health professionals. It's so important, as Sharlene will mention, to think One Health in your day-to-day work, and taking a One Health history, and following Hippocrates, who said to us, it's better to know what sort of person has a disease than what sort of disease a person has. So knowing when and where your patients are at risks, and identifying vulnerable patients, including women, outdoor workers, farmers, slaughterhouse workers, and taking into consideration the economic, the social, and the environmental determinants of health when you're making your diagnoses. So thank you very much for that. And I will now pass back over to Sharlene, who will give us a case study.
Thank you very much, Professor Oura. Don't feel you could get away by passing this on to Sharlene so quickly. No, no, no. So thank you very much for that very informative lecture. I have heard you so many times, but every time I hear you, I learn so many new things. And I have to tell you all a little bit about Prof. Oura. So we all know about COVID-19, right? We know that COVID-19, we first heard about COVID-19 somewhere starting in December of 2019, okay? And it was very early in the January of 2020. Now remember, wait, my video went off again. Yes, so remember, right, that it was only, I think, in March of 2020 that COVID was declared what we call fake, public health emergency of international concern in March. But in the first 2 weeks in January in 2020, I remember walking with Prof. Oura in Trinidad and Tobago. It was the first planetary health conference. And he said, listen, this big wave is going to come and it's going to take the world by storm, and it's going to be huge. And I don't know how we're going to cope. And I'm thinking, like, what is he talking about? And then he said, you know, in the wet markets in China, this is going on. And I'm telling you, I really don't know how we're going to cope. And because he was Prof. Oura, I was listening intently, and he's doing it again. He's telling us about the future so we can change our ways in the present so we can now have better outcomes in the future. And he's told us everything. He told us what we could do as individuals. He told us what we need to do in terms of our surveillance system, in terms of habitat conservation, in terms of developing new models. I mean, what else? You have somebody telling you about the future so you can change the present. It doesn't get better than that. So that's Chris, Dr. Oura, Prof. Oura. You're not going to get away. We have to thank you for this. Thank you for guiding us every single time. And of course, you're going to have a lot of questions to answer. So please stay by. I know it's wee hours of the morning where you are, but you need to stay up because we need some more information from you. And thank you. And we're going to let you off the hook now. And we're going to ask Sharlene, Dr. Sanchez, to come on. We have been waiting patiently to hear you, but let me just tell you, I love the young people. I love the youth, because you see, people like us, older people, we are leaving, and it's the young people like Dr. Sanchez who would be taking up this baton. She would be taking up the fight. And so it's very appropriate that she would be here today to tell us more about what's going on in the world presently in terms of zoonotic diseases, and giving us a few tips on what we should be doing to improve the situation. Welcome, Dr. Sanchez. Take it away.
Thank you so much, Dr. Henry. So I'm going to share my screen. So just having some problems starting the slideshow from beginning. Let me just try again here.
You can just hit
Okay.
from the beginning. Right, you got it.
Everyone, be able to see?
Yes, clearly you're on presenters mode. Go ahead, Doc.
Yes. All right, so thank you so much again, Dr. Henry. I wish to acknowledge Dr. Stanley Giddens as well, Senior Lecturer at the University of the West Indies, Faculty of Medical Sciences. Thank you to the organizers of this course, the Caribbean Climate and Health Responders course, and welcome to all participants. Today, I'll be presenting a case history of a 42-year-old gentleman who was previously well, but presented with fever for 3 days. His fever was low grade, and he complained of extreme tiredness. He had low energy levels and was not feeling his normal self. He also had missed work for the past 3 days, and his main intention for coming into hospital was that he needed to receive a sick leave certificate. So on review of systems, he had nausea for 3 days, and additionally, he had vomiting and diarrhea for the first 2 days. He felt better after taking Andrew's liver salts. So this gentleman also had a non-productive cough and complained of pain in the lower extremities and to a lesser extent, his upper extremities. So we examined him and his temperature was noted to be 38 degrees Celsius. His blood pressure was 118 on 72. His heart rate was 96. Respiratory rate was 16. And his oxygen saturations was 96% on room air. He was also anicteric, but had mild conjunctival hyperemia. On examining his throat, we noted mild erythema, and his respiratory examination was normal. On examination of his abdomen, he was noted to have mild enlargement of both the liver and the spleen. And his muscles were very tender and stiffness was noted. If you look at the picture on the side, you can see this maculopapular rash that he presented with, and it was so marked on the torso, upper, and lower extremities. So now he comes and he's very, very grumpy because he really came to hospital for a sick leave and he only had $100 TT. Now, this is a very ill gentleman who, if not treated, can progress to becoming very critically ill. But look at his major concerns here. His major concerns at this time is income and employment. So we want to move on to get some additional history for this gentleman. So on additional history, we noted that he resides and works in Port of Spain. By occupation, he's a sanitation worker. And these graphs show the average number of sunshine hours in Port of Spain, as well as precipitation in Port of Spain. Note that he presented during the rainy season, particularly in the month of August, where the precipitation rates are higher. We delved into his social and family history, and he had all basic amenities, but was of the lower socioeconomic group. He also had inadequate housing and poor sanitation. He also lived in a 2-bedroom house with his wife and 2 children, as well as his mother and sister. So of note, his mother is type 2 diabetic and hypertensive, and she had an appointment to the local health facility but was unable to keep that appointment because of recent flooding in his area. His wife was also noted to be pregnant, and she was at 12 weeks gestation. So all of his social and economic backgrounds come into play, and it is quite complex. And this web and interplay of social constructs come into play with climate change and the possibility here of a zoonotic infection. So it is so important here to take a social and a family history as well as an occupational history. So of note, this gentleman also owned a dairy cow, and the land space by his home was also very minimal. So we have the interplay here now with the cattle, and he also takes his cattle out to graze on a regular basis. So a sanitation worker by occupation, part-time, he takes his cattle out to graze. He has a dairy cow, and he also has this whole entire family history with a wife who's pregnant, as well as a mother to take care of with chronic diseases. And the time that this occurs is during flooding in the rainy season in Trinidad, in Port of Spain. So he's very stressed, but he never smokes in his life, but occasionally consumes alcohol, 12 to 14 units for the entire month. He has been extremely stressed about the situation, especially the recent flooding. And about 3 days ago with his friends, he consumed more than 5 drinks at the bar for stress relief. Of significance, he had no sick contacts at home or at work. So we know that he is a sanitation worker, and he also works a 40-hour work week. He also does extra shifts when offered. So this is someone trying to make ends meet, trying to provide for his family, and does extra shifts when offered at work. The environmental history includes heavy rainfall and floods. And as we mentioned before, he presented in August during the rainy season, where there was recent flooding in the area that he resides. So this again shows the precipitation levels in Port of Spain, the average levels during the rainy season in Trinidad and Tobago. Additionally, this gentleman is still cleaning his surroundings from the debris from the recent flooding. There's a very high mosquito content in the area. And as mentioned before, he lives in Port of Spain in Trinidad. So our differential diagnoses that we need to consider here, because on examination he was anecteric, is anecteric leptospirosis. But we also need to consider respiratory tract infections, particularly viral infections like influenza, COVID, the common cold, and respiratory syncytial virus. We can also consider here dengue fever, Zika, and chikungunya. So other considerations for this gentleman is alcoholic hepatitis, hepatitis A and B, and pancreatitis and hepatobiliary disorders. So what investigations we would like to do for this gentleman? So we can consider doing a complete blood count. In leptospirosis, the white cell count can be high, it can be normal, or it can also be low. So of note, it can be normal or low. The platelet count may be decreased, and the hemoglobin and hematocrit may also be decreased. In our liver function panel, we can look at bilirubin levels as well as the liver enzymes. And in our renal function tests, we can look at his creatinine, bun, and electrolytes. Inflammatory markers can also be done, particularly the ESR and the CRP. And remember, in this gentleman's history and examination, he complained of severely sore muscles. So the creatine phosphokinase can be used as a marker for muscle injury. So of course, considering our other differential diagnoses here, We can do dengue serology, particularly the NS1 antigen. We can also do leptospirosis immunoglobulin M, and urinalysis to assess for protein, pyuria, CAS, as well as blood. Remember too that leptospirosis also affects the heart and pulmonary system. So chest x-ray and an electrocardiogram can also be done for this gentleman to assess any other organ involvement. So this gentleman, upon further counseling, was admitted to the tertiary care hospital. He decided that he wanted to stay in the hospital and that he wanted treatment because he had so many other factors in his life that he had to deal with to go back home. A pregnant wife, a mother that was diabetic, as anicteric leptospirosis, and he was treated with IV penicillin. His condition improved and he was discharged at day 5 to complete an oral course of antibiotics. So of course, remember that it's not this gentleman alone we're treating. We encourage and continued antenatal care and management for his wife, who was pregnant in her first trimester. We encourage all the necessary support services. Remember also that she is at risk for other arboviral infections, as Prof. Chris highlighted in his informative lecture. She's also at risk for, she requires social support. She might be depressed. She has so many other things that she's dealing with within this first trimester of pregnancy. Remember also this patient's mother is type 2 diabetic and hypertensive and requires chronic disease management and was unable to get care for her chronic disease. Also remember that this guy also had a cattle that was a dairy cattle that he took out to graze regularly. So we also wanted veterinary services for this patient's cattle. We wanted to also give relevant notification to all the authorities, especially given this recent flooding and diagnosis. For example, insect vector control and all of the relevant authorities in Trinidad, as well as psychological and support services. So this case highlights all of the impacts or some of the impacts of climate change that can affect this gentleman and his family and the wider society. We looked at severe weather conditions, water and the impact on flooding, access to food, access to water, changes in the vector ecology, the numerous social consequences, the psychological and psychiatric impacts, veterinary care for this patient's animals, the impact on non-communicable diseases, for example, his mother who was unable to access chronic care, maternal health, and the socioeconomic, political, and economic burden. So this case highlights this gentleman's dilemma and all of the factors that were involved in the management of this particular patient. So some of the factors we'd like to highlight would be that untreated leptospirosis can be very, very fatal. This gentleman opted to get sick leave and go home, but on further counseling, he decided to stay for treatment. A careful environmental history is a must. Remember your family history, social history, and occupational history. Constitutional symptoms are common to both viral and bacterial infections, and it can also overlap with other autoimmune etiologies. Early treatment is extremely important and key to saving lives, economic costs, and the need for tertiary care, of course, which comes with a carbon footprint. Now, in closing this presentation, I would like to highlight Professor Chris's last slide, that we should always think about One Health in your day-to-day work. And quoting his saying from Hippocrates, it is better to know what sort of person has a disease than what sort of disease a person has. And this case highlights that. Thank you very much, everyone.
Thank you very much, Sharlene, Dr. Sanchez, for that wonderful presentation and bringing life to what Dr. Chris Oura just presented, a real life case. And thank you for highlighting the point here that the patient, we need to find out more about the patient rather than the disease process. Okay, so what we're going to ask now is for both speakers to put on their mics and so we can see you. And then I would field questions from the audience to you. And so the first question is for you, Dr. Sanchez. However, I am waiting to see Dr. Oura. Did he fall asleep? I mean, what time is it? 1 o'clock in the morning? Now in Spain?
I'm here, Paula.
Oh, you're here. I need to see you. I need to see you. And we
Yeah,
need to see. We need to see you.
My video should be on. Can you see me?
Okay. I can see you now. I can't see Dr. Oh, there's Dr. Sanchez. Okay, so Dr. Sanchez, the first question is for you. So you spoke a lot about telling us about the importance about getting a history. In other words, prevention, finding out very early what to do. You told us also about early treatment, the importance about treating this case very early so that we could prevent, say, undue complications, severe complications. What can you, so this is the question, what can you tell us about the dengue vaccine? Because obviously if we had a vaccine, we wouldn't have all these problems. So what can you tell us about what has been done so far in the development of the dengue vaccine? I mean, we need a vaccine, don't we?
Yes, so from what I recall, the dengue vaccine, there are many different epitopes and antigens that we have to deal with in the manufacturing of that particular vaccine. And I know that there were studies that were done on it, and they were not quite successful as we would have liked it to be. So in terms of a vaccine for the dengue virus, because of the Den 1, the Den 2, and the different types, it was still in progress and still in the making. And we have not yet quite come up with a sustainable vaccine for use with everyone. But Dr. Oura, you could also add any comments you like to on that
what
one.
you said, Dr. Sanchez, is that because there are so many different serotypes, serotype 1, 2, 3, and 4, it's difficult to develop a suitable vaccine that can cover all 4 serotypes. Yes, let me hear Dr. Oura's take on this. This would be interesting.
It's been a real struggle finding a dengue vaccine that works. There's been a lot of work, a lot of money's been put into trying to find an effective dengue vaccine, and some of the pharmaceutical companies have had their fingers burnt quite a lot. It just, yes, obviously there are 4 serotypes, and there's also the problem with possible immune-related responses to the virus, and which are for the vaccine as well. And then there's of course the hemorrhagic form as well. So it's proved very difficult to find an effective a vaccine with sufficient degree of protection against the different serotypes. They've tried to produce a vaccine that protects against all 4 serotypes, and that hasn't proved particularly successful. I know they are vaccinating though. In Brazil, I think they're vaccinating at the moment, because there is some level of protection, but it's just not, as far as I understand it. I'm not an expert in dengue vaccine. There may be more experts on the call, but it's not as effective as one would like.
Okay, so I don't want to put Dr. Sanchez again on the spot, but the next question is probably directed to you again. So we know of dengue hemorrhagic fever, and that has been a challenge for us because it's the cause of death for dengue fever. This is the question. Somebody wants to know if there's a relationship between any particular dengue serotype and the development of dengue hemorrhagic fever. In other words, trying to give us the relationship between dengue, development of dengue, and dengue hemorrhagic fever. I mean, what can we expect? When do we panic if we have a dengue type 2? I mean, tell us a little bit more about that, please, Dr. Sanchez.
In the cases that I've encountered within the hospital and in the past, there wasn't any particular relationship between the serotype and the specific type of fever. What we've seen, though, is that certain persons with a family history or recurrent dengue fever would be more likely to develop dengue hemorrhagic fever. I believe we've seen this in many studies. We have just seen an observational type of picture in the hospital, but we have seen where patients of one particular family or with recurrent dengue tend to develop dengue hemorrhagic fever more than others. And of course, dengue hemorrhagic fever is life-threatening, and it has all the various complications associated with it, and it is a disease that we treat that requires close monitoring, close support, and even critical care management. But in terms of observation in the hospitals that I've been working in, we've seen it that it tends to run in one particular cohort or family, or in patients who had recurrent dengue fever in the past.
Okay, so I'm supposed to feel very, very scared because I have had dengue type 1, dengue type 2, and dengue type 4. So I need to feel very scared because if I get type 3 now, I would be at risk. So thank you for that information. That is very, very helpful. Also, so we know our vulnerable populations. So the next question is to Dr. Oura. And somebody is asking about the vaccines in the animals to try to prevent spread or to curtail spread to humans. And you talked about the cost analysis, saying if we could stop it at the level of the vector at the level of the animals, then we decrease the cost. So could you tell us a little bit more about this, Dr. Oura? What is being done right now in terms of immunizing animals?
Yeah, I mean, we're looking towards, I mean, a good example at the moment is, I expect many of the people listening will know there's a very severe outbreak of avian influenza going on around the world. And many, influenza virus, avian influenza virus, of course, has a big risk of passing across to humans because it's a very plastic virus and it changes and rapidly mutates and reassorts and changes. So this is something that that the veterinary profession is very aware of, and historically we haven't actually vaccinated birds against the highly pathogenic avian influenza viruses. But what's happening now, because of the risk, and we're seeing it spread to many different mammals, and last week it was in cows, in cats in America, and lots of Arctic, Antarctic birds and mammals are being affected. So there is a strong push now to vaccinate poultry across the world, and certain countries are now doing it, like France, so we can stop this highly pathogenic strain of avian influenza in the animals, in the birds, before it gets the chance to move across into humans, because that could potentially be disastrous. We know this virus has the potential to move across different species, but so far it hasn't gained the ability to spread from human to human. So that's a good example of what you're saying. The question is saying is, if we can stop the viruses in animals through vaccination of the animals, we'll stop them getting to humans, and we'll stop the pandemics. Also, critically, as we've seen from COVID, stopping the virus getting across from animals to humans is not only through vaccination, it's also through sanitary measures, through stopping for example, the very unsanitary way that wildlife are slaughtered in wet markets that you mentioned earlier, which enables viruses to jump across from the blood of those wildlife species into humans, who are actually chopping them up and things in wet markets. So there's also biosecurity and sanitary measures that should be put into place to stop those viruses being able to make that jump from animals to humans. So many different ways we can address that, and we can try to avoid that spread.
So I have a little take on that, because I think most people here know I'm a primary care physician, and we don't have good surveillance systems. And we are isolated as primary care doctors in our little office. And, you know, they think all we do is treat cough and cold. And I am telling you, every time there's an outbreak of avian influenza virus, I become very cautious. Just like an outbreak of dengue, or like how we had chikungunya, we're going to get whacked, right? And very early in that, we would normally see a couple deaths from respiratory infections, usually in young people. And when that happens, you tell them, because we know it's. So what I'm trying to say is some little bit could be passing on. And we as primary care physicians have to take it early. What you're talking about is control, right? Controlling everything at whatever sphere you could. So, and that is very, very important. And thanks for that. That's good news that we're all trying to contain it at the different level. Okay, I have another question here for from Antonia Joyette, and this is for Dr. Oura. What are the potential indirect health effects of climate change on vector-borne and zoonotic diseases in the Caribbean? And they're speaking specifically about changes in water quality, food security, and the prevalence of other infectious diseases.
Okay, well, I mean, the direct effects that we mentioned today, you know, the direct effects would be like sort of the temperature rises, the increased precipitation, the increased rain that are going to affect things. But there are also things like what we talked about, deforestation, things like that. That there are other things, that there are other areas that are going to have that are going to have effect on the vector-borne diseases and the vectors indirectly. And my mind, I can't think of any at the moment, but there are many indirect effects that can also cause that can also cause the effects of climate change. You know.
Okay, so yeah, so somebody brought up a big question on deforestation, and we know that deforestation is a big cause that's driving this process forward. And because we're getting now in closer, the animals are now coming into our space, and we are going into their space. So the question is, deforestation is a big issue, a big problem. What can be done, right, to stop the cycle of deforestation? That's the question. What can we do to stop the cycle of deforestation?
That's a very big question, because there are, of course, there are a lot of other drivers for why people are carrying out deforestation, and there's a lot of economic reasons, you know. But I suppose we have to really make people understand the importance of nature, and the importance of maintaining habitats for our wildlife, because the more that we chop them down, the more chances are, of course, that we're going to come into contact with the viruses and the bacteria and the pathogens that are quite innocently circulating in those forests, and have been for years. And it's us going in and chopping those forests down, and people going in, bringing in the potential, or getting in very close contact, in closer contact with those pathogens, so they get the chance to jump across. I mean, we have to make people understand, for so many reasons, the importance of our forests and the importance of our nature and the importance of conserving nature. Of course, there's critically for climate change. Of course, we know that our forests are so important as a carbon sink as well. and reducing, and reducing carbon output. So there are so many reasons why we should be protecting our forests and stopping deforestation. But the problem is there are economic reasons why people want to chop down the forests.
Of course, yes.
And it's changing people's minds in governments and changing people's minds, to make sure that we can try to push the balance across to conservation, and away from economic gain. And that's a big thing. I can't really, I mean, it's difficult to answer.
Okay, so that's great. Now we have so many questions, we can go on all night, but we know you have to go to bed, Dr. Oura, and we know that people need to take their dinner. So we're just making sure that Nico, who is behind the scenes today, posts the post link survey in the chat now. Please look for it. Please look for it. So you can fill that out. So you can start filling that out now. It's going to close early tomorrow morning. And you can get the link for the CMEs there. So please fill it out. While that is happening, I'm going to share screen again so you can find out what's going to be happening next week. So next week, we have another exciting session on mental health. And we have Dr. Peter Weller, who has addressed us before. And very importantly, let us get all the nurses on board, because we have Nurse Josephine Williams. And she is going to tell us, she's going to bring the case history on the mental health. So, and of course, our moderator, Dr. Pert, who is from EarthMedic, EarthNurse. So, this is the final slide. So please, you can click on the QR code so you can get the post-session survey. And I want to thank everyone for coming today. It's been a fantastic audience, great participation, great questions. And of course, we cannot leave. We have to thank Nico. He has actually carried the show today, because Cecilia Sorensen and Haley, who are our backbones, they weren't here today. Thank you, Nico. But we cannot leave without giving Dr. Hospitalis the final word. Thank you. That's Nico. Nico. Thank you, Nico. He showed us our face. Yeah, he's the man who made sure everything was right on target. And Dr. Hospitalis, you have the final word.
Thank you very much, Paula, and thank you for your great moderation. Thanks to the 600 plus participants that stayed with us to the end. Professor Aura, Dr. Sanchez, great presentations. If you saw from the chats, people like how a veterinarian was working together with the medics to bring that One Health perspective. We look forward to seeing you next week, when we're going to be looking at mental health, and Josephine Williams will be presenting on the mental health impact of patients families who had to abandon their homes after Hurricane Irma. So see you all next week. Have a good evening. Bye-bye.
Bye. Thank you for coming. Bye.